blackouts, sweaty skins, power cuts, heat strokes. But now there is an impact possibly on India's economic growth as well. I'm talking about a study from the University of Cambridge that has raised an alarm about the impact of heat waves in India. In fact, the study says nearly 90% of India could be severely impacted by an abnormal rise in temperatures caused by climate change, even as the country reels from scorching heat conditions. Already, over the last few days, we've seen several major cities in India touching sky-high temperatures in the 30s or even early 40 degrees Celsius. Now, heat waves will not only adversely hit people's productivity, but critically hamper the country's progress towards its SDGs. And it doesn't seem so far away. Over 48 meteorological stations have recorded more than 42 degrees Celsius on Tuesday, with the highest at 44.2 in Odisha. Since 1992, more than 24,000 people have died because of heat waves in India, and the impact is expected to get worse. Now, we're going to look at a few things on today's show. First of all, we're going to try and understand the current phenomenon of heat waves that we're seeing. Is it persistent? Is it for a few days? Secondly, what's the big picture? Are we looking at this as a result of climate change? Are there other factors? And of course, how can you, the individual, protect yourself? So let's begin. I'm joined today by Dr. Rahul Tambe, Senior Consultant Internal Medicine at Nanavati Max Speciality Hospital, Dr. M. Rajeevan, former Secretary, Ministry of Earth Sciences, and Vimlendu Jha, Environmentalist, also with us on the show today. Welcome to all of you. Dr. Rajeevan, let me begin with your take. When we're saying, and you know, we've also seen hottest February on record in India since 1887, that was in Feb this year. We're seeing new records now being broken because of the current lot of heat waves. What is the reason of this phenomenon in your view?
It's basically natural phenomena. It is nothing to do with the climate change. But what we are, even without any climate change issues or global warming, still heat waves can occur. The heat waves are just a few days of abnormal temperatures. But what we are worrying is the frequency, duration, and intensity of heat waves are increasing. That is definitely due to global warming and climate change. So what we are worried about the increase in frequency, duration, and also in the intensity of heat waves. And we have evidence based on the past records of observations that heat waves are definitely happening in India, as in any other parts of the world. And also the frequency and the duration and intensity are increasing with time. So if you analyze last 50 years of data, we have seen that substantial evidence that this frequency, duration, and intensity are increasing. And if you want to see that whether future climate, whether this kind of trend will be seen, yes, definitely it is seen. The future climate model projections also says that this the long-term trend which we are seeing will continue in future, and we will have more and more long-duration heat waves with the high intensity of temperatures. So the heat waves are going to stay back with us for many more years to come. We need to really do some kind of policies, strict policies, to adapt and live with that heat waves.
Okay, so we have to adapt and live with the heat waves, but do we even have policy action right now? We know the horrific incident where 14 people died, you know, just attending an event in Maharashtra. Clearly, there is no idea right now. I mean, in a lot of countries where temperatures get this hot every year, then there is public policy in place. There is restriction of outdoor work during certain hours of the day, etc. I want to come first to Vimlendu Jha on a certain point that, you know, Dr. Rajeevan also said. He's saying you can't link it to climate change. And this is an important question, Vimlendu, because everything and every unseasonal weather pattern gets linked to climate change. Do we have any data or evidence to say that what we are seeing right now is in a sense man-made because of climate change?
Absolutely, Tamanna. If you look at the IPCC report that was released, the sixth assessment report that was released exactly 1 year ago in March 2022, which was actually signed by more than 197 countries. There were more than 270 top-notch scientists of the world that actually put India on notice. It clearly talked about the heat wave discussion that we are having today, and it clearly also talked about the loss to GDP of almost around 10% to 23% by 2100. And therefore, for us to say, well, this is not linked to climate change, there's no evidence, is a slightly misplaced in that sense. All the climate change conversation that has happened, and in fact, the doctor who spoke before me also said that, yes, if you look at heat wave can be natural, but the frequency of heat wave or the intensity of heat wave that we see right now is clearly alarming, and therefore it is attributed to climate change. And this is global. In fact, last year we saw almost 50% of US population was actually suffering because of heat wave. There are parts of Europe that actually suffered as well. But again, when we talk about suffering of the first world and suffering of countries like India, Bangladesh, Thailand, China, many other countries, it's extremely different. Right now, the current report from University of Cambridge clearly talks about how almost 90% of India's population is vulnerable. We have seen evidence just last week of people dying up because of heat stroke, but heat wave and heat stroke are two different things. That was a political rally where people were exposed to a particular condition. These two need not be connected. But the fact that we are actually staring at 42 degrees, 43 degrees in the month of April, the early onset of heat or warm temperature is something which is, most scientists say that is more alarming, and it has to be linked to climate change and things that we are not doing rightly, or things that we are actually doing in a very, very wrong way.
No, the connection, Vimlendu, the connection is that, okay, that was a rally. That's why people were sitting there for many hours. But a lot of people work outdoors, live outdoors.
Absolutely,
there are
Tamanna,
homeless people in this country. They are exposed to the elements. And if you're going to have a series of heat waves, do you have a plan?
Absolutely. Ideally, when the assessment report that came, there was a lot of discussion across TV channels by the government as well last year. And last couple of years, we've been discussing heat waves, and which should ideally mean that a scientific report that the government of India has actually signed, there should be adequate, proportionate, subsequent, policy making and action points. But we don't see anything. And that way, you are right that, if we are talking about heat waves in the last 20 days, what was the occasion to really have such a rally? Why are we exposing more than 450 million people in our country are in the labor force, exposed to sun each day, and therefore what's our preparedness? So it's live, and it's also livelihood that is at question, and this needs to be tackled as a short-term measure in terms of immediate relief that we can actually provide to people who are extremely, extremely vulnerable, and in medium term and long term look at how do we reverse this process, because there's no other planet B, as in we will have to look at a solution as a country, as a region, and as the world. And that's where IPCC reports or all the discussion that's been happening globally makes real sense, because now heat is not just about feel, it's about life. It's not just about you feeling heat or feeling cold, it's about actually taking people's life. And most vulnerable are children under the age of 1 and elderly above the age of 65. And indeed, every single person who is vulnerable, the poorest of the poor, the most. And we always say that poorest of the poor people are most vulnerable to climate change.
So there is a health impact, there's policy impact, there's of course economic impact, because if conditions become so difficult, you will have to restrict the jobs or the work that happens out in the environment, or outdoor jobs. They will have to be restricted in these months. You already have some schools that have shut early, to make sure that children are shielded from the heat. On an individual level, Dr. Rahul Tambe, how can we be careful? Those who can use air-conditioned environments to the extent they can, but it's not always possible for everyone at all times.
Yes. So the climate change is there, and I don't see that we are going to have a reversal soon, whatever efforts we are going to make. And the previous two speakers have said well. And if you look at the kind of people which are involved are probably coming from the lowest socioeconomic, people who are on daily livelihood and are working outdoors. Now, a couple of things we should take into consideration. One, now, because we are going to see this very frequently and quite often in a prolonged period, the summers are really stretching for more than 3 months and temperatures being so high. One is making people aware of it. For example, school children should be made aware that they should be hydrating well pretty often. Also, the people who are employed in the outdoor, probably the people who are responsible for employing should make adequate facilities available where they can take some time off, probably in a shaded area, give a good amount of access to water for hydration, because that's another very important natural coolant is that you drink plenty of water. And overall awareness that even you might think that spending some time in the sun may not be so harmful, but you often underestimate the power of the environment. Often people are taken away. Also, it depends upon what's your hydration status, how long were you really exposed to that kind of condition. If you're aware of the last rally, what happened was that people were exposed for a very long time and they were bound to have some kind of a trouble. But you see, now we are getting people who are really normal people who have been, say, outdoor for another half an hour, 30 minutes, or even 1 hour. They are also reporting to the emergency department with severe headache, sudden onset of giddiness, where they had to actually sit down at the side of the road because they felt too exhausted. Some came with confusion, some really collapsed. So here you're talking about a problem which is not only restricted to rural area or a certain strata of the society. The rich, the poor, whether you are in a rural environment or you're in an urban environment, they are still affected. So making awareness, it's a possibility that however good you are or physically fit you are, you need to be aware that you are a candidate for heat stroke if you are going to expose yourself to this kind of a harsh environment. And that it is very important for you to take some precautions, probably use an umbrella, use a
To
shaded
you
place.
specifically,
If you're
Dr.
working in
Rahul
the
Tambe, let
outdoor,
me come to you specifically on the precautions. You are saying the best way is prevention. Try not
yes.
to expose yourself as much as possible, but that's not always something that everyone has a choice with.
Yeah, so hydrating oneself with plenty of water will be the first thing you would look at to prevent ending up with getting a heat stroke. So water, as I told you, is a good coolant. You should consume it as much as possible. You look at your body, look at the thirst part of it, and that would be your first primary thing. Also, when the temperature starts rising, if you feel you are uncomfortable, you should immediately take some help and report yourself to a local doctor. You might really underestimate that what you are feeling the heat, maybe you are coming down with fever. And such kind of high temperature actually will not respond much with your temperature reducing medication such as paracetamol. You just need to take some water, splash some water on your face, and if there is really somebody who you feel is around you as having those problems, then he has to be moved to a shaded area, pour water on his in his body, face, etc., and report him to immediately to the closest medical center that you can is available. And then probably when once you come to the hospital, it is our job. Then we have the different kinds of tool mechanism to see what kind of complications we are looking at. Now you will be surprised that a simple heat stroke can give you a large number of complications, right from headache, giddiness, vomiting, abdominal cramps. You'll have muscle pain, and that muscle pain can lead you to kidney failure. You can have accumulation of fluid into the lung. You can end up getting coma. You can end up getting fits, what we call as seizures, and patient can land up on a ventilatory support. So often these patients are breathless, and they will have low oxygen levels. So the smaller changes you should be able to pick up, like a small discomfort, you're feeling confused, you're feeling exhausted, you can't walk anymore, mild disorientation. These are the kinds of things you should think of and probably hydrate yourself immediately or report to your closest doctor.
Okay.
Also, if you say wearing full sleeve shirts, using an umbrella, all this will help you to really prevent or progress this kind of bad episode if you're not able to avoid being going into the harsh climate.
So, at least give yourself some coverage. Look at the kind of clothes you're wearing now. Doctor, especially for children, especially for young children. I think it's good that some schools have shut early for summer vacations. Other schools which are still on, what are the kind of precautions they must take?
So school children, normally if you remember, we have a time in the after, sometimes say half an hour when you're allowed to go into the playground and play. With these temperatures running high, I think that should be really restricted. Avoid children going into the open. They do not realize they're dehydrated. They do not realize that they need to drink plenty of water. And often that's the problem with them. The other thing is that very important to provide them with good amount of access to water. You see to that these children are properly hydrated. The other thing is that they should be well covered. Probably wearing white color clothes, full sleeve clothes might be help you to some extent to reduce the kind of exposure they are going to have. If they are going to be in the open, it would be really advisable if they kind wear hats or caps so that again there is decrease in direct exposure to the harsh sun. And of course, the government itself is already taking precautions that if there's a severe heat wave or the temperature is too high, please avoid sending the children to school, and then probably it would be better off they being at home rather than falling sick.
See, these are some of the precautions we can take at an individual level, but this is a problem that needs to be tackled at multiple levels. And Dr. Rajeevan, let me come to you on what is the kind of policy action that we need to see. So the usual sort of protocol is that the central government, the specific department will send out a warning. States will then start their own protocol, their own process. But do we need to have a proper SOP in place, considering that extreme temperatures during the summer is becoming more of a frequent event?
Definitely, we need to have SOPs, but I want to clarify saying that a National Disaster Management Authority has brought out state heat action plans for many states, and many states have participated. And I remember it's about 16 or 17 states have now state action plan for heat waves. Once IMD has a capability of issuing warnings of heat waves almost 5 to 6 days in advance now. We have a capability and we are able to predict and give warnings about heat waves. And once we give the warnings and NDMA acts on it, and state government, they interact with the state government and they take actions as per the state protocol. So we have at least some 16 states. I'm not sure about Maharashtra, but many states. It started with Ahmedabad, a very famous action plans which they started, which is world famous. And then many states have now state action plans. So we have, it's not necessarily, it's not that we don't have SOPs. We have SOPs. Only thing is, it should not be on paper. It should be implemented in essence, really in practice. And we should there should be a lot of inter-ministerial or inter-agency collaboration in this. The only state government cannot really implement this. You need help from different agencies of the state government. For example, medical people, for example, police authorities, and also the public municipalities, etc. Yeah. And I want to just to clarify 2-3 things before I conclude it. And because you talked about one is the state action plans. The number 2 is not only temperature, even humidity is very important.
Yes.
So it's not necessary that 45, 46 is very harmful. Definitely it is harmful. But even with the 35, 36, with the humidity of 60, 70%, it can be as bad as 45 degrees. So Bombay, what really happening is Bombay is a very coastal town. It is very near to the sea. So you can have more humidity there. So people even with 35, 36 can have the health effect or adverse health effect of 45 degree which Delhi is experiencing. So we need to really take into account the humidity factor also. And the second important thing which I want to highlight, all people should know is, it is not that people who go out die. Of course, people going out because of heat stroke, they die. But people sitting inside home also die. For example, I can give a good example, 2003 European heat wave. 70,000 people died. 70,000 is a rich country, by countries like Germany, France, etc. 70,000 people. And half of them, I remember, half of them are people sitting inside a house because they had pre-existing diseases like asthma. They had pre-existing disease like cardiac problems. The old people who have this pre-existing disease also can can have this kind of adverse effect due to heat waves. So we should not want only people who are going out. We should also want the people who are sitting inside, and medical fraternity should come out with kind of a guidance to those people who are sitting inside. And in India, we forget about that kind of incidents which is really happening, and we may not be knowing. People see, for example, a cardiac arrest. When you go to a hospital, people say that doctor will say no, he had a cardiac arrest, cardiac problem in the history, so he died because of cardiac arrest. But only on that day, why? The question is why on that day? So that is mainly because the heat wave really, that's what the literature shows and evidence shows of 2003 heat wave. So we need to have multiple kinds of policies, multiple kind of policy issues which are related to health impacts. And also, as I said, that the heat wave can impact agriculture, heat wave can impact the energy sector. So you need a multidimensional kind of policies, which government is working on that. We need to really go.
Sure, sir. Vimlendu, I want to come to you on big picture. And there are enough reports now, including the University of Cambridge one, but more and enough reports which talk about temperatures rising in these months over the next few decades. This is going to consistently increase. Right now, conditioned environment or ACs are something that the relatively rich have access to in the country. We need to find ecological ways to keep people cooler as we go ahead, isn't it?
Absolutely, Tamanna. First of all, AC is not a solution. It can be a temporary respite. In fact, AC or our energy consumption is part of the problem and not part of the solution. But we think that just because we're cooling it instantly and cooling it privately, and therefore we're able to get away from heat wave. In fact, if we're imagining a world in 2100 where we're saying that there's going to be a lot of heat wave in different parts of the world, a large problem of it would be our per capita energy consumption that has gone up, that is leading to climate change, and that is what indeed is leading to heat wave and everything else. I think in this big picture of heat waves that we're talking about, the problem in our policy making is that we indeed have heat action plans. In fact, the famous 2013 Ahmedabad heat action plan that the previous speaker was talking about, and similarly there are almost 37 heat action plans that we have in the country. Most of them have failed because, one, of course, these are completely unfunded and on paper. But the bigger problem to these heat action plans are that they are not localized and they are not granular. Not localized in the sense you cannot just have one plan for the entire state or one for the region. Because there are different states and different districts behave differently in that sense. And granular in the sense that if there's 3% of land mass that actually has 90% of the workforce that is exposed to sun, therefore you will have to have a different kind of an action plan for that particular region. And therefore, in this entire management, that's why I keep saying that indeed a temporary relief, a short-term measure indeed can be looked at, an immediate respite, an emergency. Perhaps an admission of or relief is important, but unless and until we don't look at our energy consumption, our sources of energy, unless and until we don't look at our mobility, unless and until we don't look at our greening efforts, as one of the things that came in action plans is that how are we actually looking at afforestation and deforestation measures? These are all linked stories, but we look at things in silos based on our convenience. AC is not a solution. I can sit under AC and perhaps find a temporary relief to a 48 degrees or a 52 degrees. And that too, as you rightly said, the richest of the rich can perhaps afford to do that. Right. But that is a problem. That is what is causing heat wave and not really solving heat wave.
No, so you need more energy efficient, ecologically, safe, and a wider available way to cool people down. You will have to find ways to cool people down, and we'll work in that direction. A lot of food for thought. Thank you so much to all of you for joining us today. And here's wishing everyone who's facing that scorching weather a very safe and happy summer. We'll take a very short break, but we'll be right back with a lot more. Stay tuned.